While it's normal and healthy to sweat, for at least 3% of the population, excessive perspiration is a horrible problem.
Normal was 3 or 4 shirts a day.
I've had computer programmers where they actually have damaged keyboards by sweat leaking from their hands into the keyboards.
It's embarrassing and often leads to social anxiety. On top of that, Dr. Sanjay Sharma from the Sweat Clinic says it can cause infection.
In conjunction with the antiperspirants, it can lead to a chronic eczema type problem.
Doctors don't know what causes the problem, but the good news is you can put a stop to perspiration. For mild cases, the starting point is a clinical protection gel.
These gels, when they mix with the sweat, form a sludge, and they can locally block the ducts of the sweat glands.
If that doesn't work, many sufferers move on to an at-home treatment which involves passing low-dose electrical currents through the hands and feet. The downside is it takes at least 45 minutes and has to be done weekly.
Realistically, it's a lifelong commitment, and many patients aren't prepared to do this.
Many have had success with Botox, but it's expensive and not permanent.
Your symptoms will recur maybe 3 to 6 months after.
Bradley Clarson used to suffer from excessive hand and face sweat.
The hassle that it was to wear glasses, from constantly fogging up, constantly being covered in sweat, it made it really hard. I'd be cleaning my glasses 20 times a day.
That's all changed since he had an endoscopic thoracic sympathectomy, or ETS.
It has been absolutely amazing.
The procedure targets the nerves that are connected to the sweat glands. Those that affect hand and face sweating are located over the back of the ribs.
We make a 7 to 8 millimetre incision in the skin just near the armpit, and with a camera we can go in between the chest and the lung and identify these nerves, and then divide these nerves.
The surgery costs about $6,000, partially covered if you have private health insurance. For 95% of patients, it's highly effective, but in some cases it causes sweat to shift elsewhere.
Not having the sweat on the face is worth sweating a bit more from the legs. It's nowhere near as embarrassing.
For sweaty armpits, there's the miraDry.
And it works by transmitting electromagnetic energy into the armpit area, and that actually causes the sweat glands and the odour producing glands to stop working.
Former House Rules contestant Russell Brampston had such sweaty armpits during filming, he was constantly having to mop up.
They had long sleeve shirts, so they'd stack all these nursing pads under my arms and it solved the problem.
Now it looks painful. How does it feel?
No, it's all numb, so I can't feel anything.
They've developed a new system of applying the numbing injections so that we can make it completely comfortable.
Patients will be a bit sore and swollen in the days following, but on average there's an 85% reduction in sweat.
Been a good result.
Awesome.
No more sweating.
Most patients only need one treatment at a cost of about $2,700.
As well as stopping sweating, it reduces odour, and it will also reduce, to a certain extent, the hair in the armpit.
Now I know for the fact that I won't have to stress about sweating and having BO.